Hello and welcome. Today we will be learning about Parkinson's disease. Parkinson's disease is a chronic progressive neurodegenerative disorder characterized by slowness in the initiation and execution of movement. Parkinson's disease is primarily associated with the gradual loss of cells in the substantia nigra of the brain. This area is responsible for the production of dopamine. Dopamine is a chemical messenger that transmits signals between two regions of the brain to coordinate activity. The loss of dopamine disrupts the normal balance of acetylcholine and the basal ganglia. Acetylcholine performs as a transmitter at all neuromuscular connections, and it stimulates muscle contractions. This is a PET scan of a normal brain versus a Parkinson's disease affected brain. As you can see, there is less dopamine highlighted in the Parkinson's disease. Manifestations of Parkinson's disease do not occur until 80% of the neurons in the substantia nigra are lost. Parkinson's often starts with a tremor in one hand. Other symptoms are slow movement, stiffness, and loss of balance. Here I have broken down all of the body systems affected by Parkinson's disease. Parkinson's disease also affects speech. It can cause impaired voice or voice box spasms. It affects mood, causing anxiety or apathy. It can cause a distorted sense of smell. It can cause a urinary dribbling, facial jaw stiffness. Also common are blank stares, constipation, depression, difficulty swallowing, drooling, loss in contrast sensitivity, and trembling and weight loss.
Now we'll be looking at the labs and diagnosis for Parkinson's disease. In terms of labs and tests, there are no specific labs or tests that can be used to diagnose Parkinson's. Blood tests and imaging tests such as MRI, CT, ultrasound of the brain, SPECT, and PET scans may also be used to help to rule out other disorders such as strokes or brain tumors. MRI and CT scans on their own do not show specific finding of Parkinson's. So what will the neurologist take into consideration when diagnosing Parkinson's disease? The medical history of the patient, the family history. If the patient has family members who have been diagnosed with the disease, this is significant because 15% of cases of Parkinson's are situations where the patients have family members who have the disease. The neurologist will also consider the presence of environmental risk factors such as use of well water, exposure to pesticides, herbicides, industrial chemicals, and if the patient lives close to or worked in a wood pulp mill, or also if the patient lives in a rural area. The neurologist will also review the signs and symptoms and clinical features presented by the patients. Also of significance is the presence of Lewy bodies, which are unusual clumps of protein in the brain, and these have been found in patients with Parkinson's disease. Clinical diagnosis requires asymmetric onset and the presence of TRAP. TRAP is an acronym for motor symptoms that are present in patients with Parkinson's disease. The T stands for tremors of the hand, and this is called pill rolling, of the diaphragm, tongue, lips, jaw, and rarely of the head. The R is for rigidity. Increased resistance would be noticed whenever the patient is passively moved through range of motion. The A stands for akinesia, which is the absence or loss of control of voluntary muscle movements. P is for postural instability, where the patient is unable to stop themselves from going forward or backwards. Confirmation of Parkinson's disease is also based on a positive response to anti-Parkinsonian drugs such as levodopa or some form of dopamine agonist. Usually, the patient is given this drug for a significant period of time, and then if they make significant improvements, then that will confirm that they have Parkinson's disease. Some patients, however, can only be diagnosed with Parkinson's if they have a number of follow-up visits with neurologists trained in movement disorders.
In this portion of the PowerPoint, we'll be talking about Parkinson's complications. Parkinson's complications include dyskinesia, which is not being able to have full voluntary control over your body movements. People with Parkinson's also have generalized weakness. With generalized weakness, it puts the patient at risk for pneumonia, UTIs, and skin breakdown. And the neurological aspect, having Parkinson's puts one at greater risk for developing dementia. Dementia is the loss of cognitive functions which interferes with daily life activities. Dementia usually occurs in patients over the age of 65, which puts the elderly at a greater risk. To continue, we look at the neuropsychiatric aspect of Parkinson's complications, which include hallucinations, depression, and also psychosis. Psychosis is a mental illness characterized by the loss of contact with virtual reality, and it often has delusions. To continue, furthermore, um, Parkinson's complications include sleeping disorders such as nocturia and REM sleeping behavior disorders, also known as RBD instead of RBC. Um, with this disorder, the paralysis that often occurs with REM sleep is absent, and the person with Parkinson's act out their dreams. Other complications include fatigue, pain, dysphagia, constipation, orthostatic hypotension, and also sexual dysfunction. When a patient with Parkinson has dysphagia, it puts them at greater risk for malnutrition and aspiration.
Okay, in this section of the presentation, we are going to be talking about Parkinson's drugs, and there are actually about 6 classes of drugs that are used to treat Parkinson's. And what actually happens is that this drug do one of two things. They either act on the dopamine or the acetylcholine. In a patient with Parkinson's disease, there is some kind of imbalance between the neurotransmitter dopamine and acetylcholine. So these drugs actually enhance the effect of dopamine on one hand or block the overreactive activity of the cholinergic neurons on the other hand. There's a figure in page 3 on page 1388 in the Lewis textbook that shows some kind of imbalance in the Parkinson's brain and a normal brain. So you can take a look at that. So the first class of drug that we are going to be talking about is the dopamine precursor. And what happens in this class of drug is that the levodopa is actually converted to dopamine in the basal ganglia of the brain. So it makes dopamine available for use in the brain. But on the slide, we have a combination drug that is actually levodopa, carbidopa, or carbidopa, levodopa, and the generic name is Cinemet. So the carbidopa actually helps the levodopa to not be converted because there's an enzyme called dopa decarboxylase that actually breaks down levodopa, making it unavailable in the brain. So what carbidopa does is to inhibit the action of that enzyme. And for this particular drug, there are so many side effects that we want to look at. The first side effect of the drug is that there is some kind of, it's hepatotoxic. So you want to monitor the liver function test, you want to monitor for RBC with differential, you want to assess for sign of toxicity, and then you want to notify the healthcare provider if there is the patient suffers from palpitation, urinary retention, involuntary movement, and behavioral changes. The next class is the dopamine receptor agonist, and an example of this class is the bromocriptine. And what it actually does is to stimulate the dopamine receptors of the brain to bind dopamine, and therefore increases the reaction. So there is some kind of a drug alert for this drug, and it's not used as a first line of treatment in Parkinson's disease. The reason is because this drug is actually, it has very serious side effects like stroke, heart attack, high blood pressure, and seizure. So it's used as some kind of, not used as a first line drug. So when a patient is taking this drug, you want to watch for signs of myocardial infarction and notify the healthcare provider immediately. And then you want to tell the patient to avoid alcohol use during this treatment. And then another side effect for this drug is pulmonary infiltrates, where the lungs just fill with fluid and all of that. So you want to auscultate the lungs for crackles and all of that. Okay, we move on to the next class. And this class is actually dopamine agonist. An example in this class is the amantadine. And what it does is actually increase dopamine release by the cells that actually release dopamine, and then it blocks dopamine uptake in the brain. A problem with this drug is that it takes up to 2 weeks for the full effect of the therapy to come into play. Yeah. And then another thing we have to know about this drug is that we have to wean the patient gradually from this drug, and we have to notify the healthcare provider if any confusion or mood change or edema, short of breath, worsening of symptoms. You want to let the uh, healthcare provider know about that. And another one of the common side effects of these two drugs that we have talked about is actually dry mouth. If the patient complains of dry mouth, you want to perform oral hygiene. They could use sugarless gum to relieve the dry mouth. They could also use like increased fluids. And then another side effect of the drug is dizziness and drowsiness. We know that with Parkinson's disease, the patients always have on some kind of unsteady gait, and when you have the side effect of dizziness or drowsiness, it means they have like risk for falls. So you want to tell them to change position very slowly. Okay, the next class is the anticholinergics. Like I explained at the beginning of the slides on drugs, I said the drugs either act on the dopamine side or the acetylcholine side. So what this drug actually does is to block those cholinergic reactors from overreacting, and therefore trying to like balancing the equation. So it's actually used as an adjunctive therapy for PD, and it may cause dizziness, so you want to change position slowly, and then you want to actually monitor the patient for I and O. You want to assess bowel functions daily, and then you want to remember that these drugs, if administered IV, you have to monitor the pulse, you have to monitor EKG and blood pressure very closely. Okay, on to the next slide, and that is monoamine oxidase inhibitors. And this medication actually the enzyme monoamine oxidase is an enzyme that breaks down levodopa. So what this class of drug does is to bind to that receptor in the brain side and stop the breakdown of the dopamine. So it helps to increase the amount of dopamine that is in the brain and that is available for use. So you want to actually notify the healthcare provider if there is some kind of severe headache. Let the healthcare provider know, and then you want to, in all the cases, you want to tell the patient to take the medication as directed, and then you want to monitor for sleep pattern changes and nightmares. And then in this class of drug as well, you want to monitor for liver function test. And then there is some kind of concurrent use. There is like, you should not use the drug when the patient is taking like SSRIs and SRNIs. So you want to make sure that there is some kind of drug compatibility if the patient is on other drugs. And then we look at the last class of drug that is on this slide, that is the catechol O methyltransferase inhibitors. And this is another enzyme that breaks down levodopa. So what this inhibitor, as its name implies, is that it binds on that receptor and blocks the breakdown of that levodopa. So it actually helps to increase the amount of levodopa that is now converted to dopamine to be used by the brain. So when a patient is on this medication, you want to watch out for liver functions. You want to not give this medication concurrently with the monoamine oxidase inhibitors. And you want to report any kind of severe diarrhea, headache, and visual changes to the healthcare provider. Another class of drug that is commonly used by Parkinson's disease patients is donepezil, that is a cholinergic, but it's not on this slide. We saw that one of the complications of Parkinson's disease is dementia. So this is some kind of anti-Alzheimer Alzheimer agent that helps with memory for patients with Parkinson's disease. There are actually three types of surgeries that can be used for patients with Parkinson's disease. The first one is the deep brain stimulation that has to do with an electrode being placed in the brain, and then there is a generator that is placed in the upper chest. What happens is that the generator delivers specific current to targeted areas of the brain. And then with ablation, the part of the brain that is responsible for all the signs and symptoms of Parkinson's disease is actually destroyed. So this procedure is irreversible as compared to the deep brain stimulation that is reversible. And then when it comes to transplantation, what happens is that fetal material, neural material is just implanted into the brain, and then it helps to produce dopamine producing cells. So with the nutritional therapy, the big issue for this patient is actually malnutrition. So you want to encourage them to eat small meals, and then there is also constipation. So you want to encourage them to include fiber and fresh fruits in their meals.
All right, finishing up this PowerPoint presentation, we're going to discuss some of the nursing diagnosis. There are several nursing diagnoses available for those suffering with Parkinson's disease. Listed are some of the more key points. Obviously, safety being a big priority for these patients. As the disease progresses, they're going to have impaired physical mobility, risk for injuries, and risk for falls. Some of the education that you can provide for these patients, such as the use of assistive devices, is going to be of great value to them. For psychosocial, a lot of the issues stem from impaired verbal communication, which leads to depression and risk for isolation. So you're going to have to talk to your patients and maybe get them a consult for speech therapy as well. A lot of the big points for nutrition and digestion is going to be that feeding is actually a very taxing issue for this patient, especially as the disease progresses. That it can be difficult, and it needs to be broken up, as previously mentioned, as far as meals, broken up into maybe 6 or more small meals throughout the day. And and risk for constipation. A lot of those interventions should be well known by now, but they can be found on page 1391. Lastly, we're going to discuss freeze-ups real quick about them, some things they could do to help prevent freeze-ups, which is when they're actually walking or ambulating, they can't move anymore. They get stuck in such a rigid tremor that they can't move. Some things they could do is actually change direction, maybe take a step backwards and then move forward. Rock back from side to side tends to help them a lot. And a big thing for them to know is not to fight through the tremors. This definitely leads to falls and possibly injuries. All right, so this concludes the PowerPoint presentation on Parkinson's disease.